Hi, my name is Robert Greenleaf, and I'm a spinal surgeon with Reconstructive Orthopedics. I wanted to talk to you a little bit today about my favorite surgery, a surgery we call the minimally invasive lumbar laminectomy for lumbar stenosis. The minimally invasive lumbar laminectomy is designed to decompress the nerves within the spinal canal for a condition we call spinal stenosis or lumbar spinal stenosis. This is a condition that's very common in many patient populations. Usually patients in their 50s, 60s, and 70s start to develop this condition, which can be very, very disabling from a pain perspective. These are patients that are often turned away by other providers either because they're too old to undergo surgery, they have too many medical problems, or in many cases, they're told by other providers or surgeons that they require a large surgery. In most cases, with the minimally invasive laminectomy that we're able to perform, we can avoid these surgeries. We can achieve the same results without having to make larger incisions, without having to do fusions, particularly in patients that may have osteoporosis or weakening bones, which wouldn't be able to handle the fusion surgeries. This surgery is truly minimally invasive in that as opposed to traditional longitudinal long incisions, which cause a lot of destruction of the soft tissues. We can do this in a minimally invasive fashion through a small tube, typically a tube about 2 centimeters in diameter, through small incisions, typically about 1-inch incisions or less. These tubes work very well because rather than having to detach muscle from its origins on the bone or split the muscle, we can go in between the muscle fibers and actually cause far less damage to the muscle tissue. This results in less pain after surgery, less bleeding, less swelling, and we can do these procedures as an outpatient. So in majority of cases, I would estimate 4 out of 5 cases we do this, we can send the patient home on the same day to avoid uncomfortable hospital stays. The surgery through these small tubes has been used relatively commonly for many years. It just hasn't been used as much for this indication. What we've done here is try to adapt the instrumentation, this technology, to be able to achieve a bigger goal, which is decompression of the central spinal canal, or what we call central stenosis.
Before I came to Reconstructive Orthopedics, I had a lot of difficulty standing up straight, not being able to get up from a chair, not being able to get up from laying down, taking a nap. You know, these are things that you learn to live with, but then when they become overwhelming, you know you have to have surgery. When I met Dr. Greenleaf, I had trust in him. I had trust he would take my pain away, and he did.
I had been stuck in a chair for 4 to 5 months. The last thing I wanted was back surgery. I tried everything first. I mean, you figure it this way. When the day he operated on me, I walked in on a cane, which I had been using for the whole time. I walked out without it.
This image is an excellent example of the lumbar decompression that we performed. The image on the left is an MRI scan looking at the patient from the side, which shows severe stenosis or pinching of the nerve roots at the level L4-5. And this patient had a grade 1 spondylolisthesis. And it can be easily seen here where the spinal canal is severely cut off and pinched due to arthritis and compression at this level. On the image on the right is the patient approximately 1 year later. We're able to see the excellent decompression we were able to obtain at that L4-5 level. The spondylolisthesis did not get worse. The nerve roots were completely decompressed, and this patient is completely free of any pain or sciatica pain and is back to all of her activities of daily living despite being over 80 years old. It is important for this surgery, the minimally invasive lumbar laminectomy, for the patient to know whether they are a good candidate or likely to achieve good results from this surgery, or would they be less likely to achieve good results from this surgery. Good candidates for this surgery should have stable medical problems. Good candidates have mostly hip and leg pain. This is pain consistent with sciatica versus the patient that only has low back pain, which is pain around the belt line or above. Good candidates have what we define as moderate or severe lumbar central stenosis on MRI scans or CAT scans. Good candidates have less than or equal to a grade 1 spondylolisthesis. Good candidates have stable alignment on x-rays. Finally, strong candidates have no prior surgeries that have been performed at this level of the spine. Here at Reconstructive Orthopedics, our primary goal is for you to have excellent outcomes. We're most concerned with your health, and specifically your health, which is why we think it's very important for you to understand the potential benefits of these surgeries and to make sure that you are a good candidate as well as a safe candidate for this surgery.